Hello, Anna. Again. Good afternoon, ladies and gentlemen. So we're ready slowly to start. There are some seats in the front. Hello, the speakers.
Hi.
Hello, the people watching us, I believe, from Shanghai, San Francisco, Schaerbeek, Roma. Hello, everybody. So now we've got to spend 1 hour and a half, if I'm not wrong, François. And and together with one challenge. I mean, several challenges. But the challenge of our talks, discussion, exchanges will be to try to see how we could use public procurement and private procurement. But let's start with public procurement, to try to stimulate, help, support, accompany, and buy solutions from innovative SMEs, from preferably European innovative SMEs. So that's going to be the challenge, to try to imagine what we could do. Us, CEOs, civil servants, consultants, anybody here in the room and on the net, to try to find ideas on how we, the European Commission, we can try to support all this ecosystem and try to make it happen, the magic of having public procurers in any sectors to buy these innovative solutions from the European SMEs. So I'm very happy actually to introduce you our panelists of the day. I will start with Céline. Céline Saint-Olive-Bach. We actually come from the same city, the city of Lyon in France. And Céline is a happy, innovative CEO of a company, Noracare, working in the healthcare. And Céline, previously to that, you have been actually an engineer, if I'm not wrong. And you had the very interesting experiences to work for Philips, but also for L'Oréal, if I'm not wrong, in China for some years, before getting back in Europe, in your hometown in Lyon, and to start this very interesting Noracare company. You will tell us about what you do. But Céline, like 5,000 other European innovative SMEs, you are part of the EIC Accelerator. This program that started in 2014 with several billion, helping European innovative SMEs in granting them, and you are one of these SMEs that receive both grants, phase 1, phase 2. Applause. And Céline, beside this though, you are in the healthcare sector, and you are trying to find these innovative procurers. You will tell us what are your challenges that you are facing, and how we could eventually support you, help you. Then we also have actually Timo Alala-Kola, and Timo is a procurer, one of these rare professionals, very important. You are sitting in a couple of million beside you actually, and you're procuring each year million of innovative solutions. You will tell us, I hope. And actually, more precisely, Timo, you are part of a European project currently, and together with Tony and Jorge. And actually, you're working on these how to test, how to help SMEs or businesses previously to be involved in public procurement, and how you accompany them. Timo, you have a master in economics. And you currently work for Holu University Hospital. Then we have Tony, graduated in computer sciences engineering from University of Bordeaux and Toulouse. You're currently living in Spain. You got a 30 years experience in the ICT sector. You worked for several years for the European Space Agency, and you're also part of this very interesting project on how to support and link innovative procurers and innovative SMEs. And then Jorge, you will have a special role today. You're going to be together. You're going to be the grand témoin, or trying to actually answer and put in perspective what the speakers, but also the audience will say about our discussions. And Roge, you got a PhD in physics from Complutense University in Madrid, and you're also CEO of an SME. You will tell us more about it. Actually, before giving you the words, we need to know a bit of each other. It's always very interesting indeed for the speakers to get to know whom is in the room. So basically, a very simple question. We're talking about procurers, SMEs, any procurers in the room, a part of Timo? Public procurers in the room? Any of them? No. Any SME, employee, CEO? Yeah, we got 3 actually. Quickly, guys, which sector are you?
I'm in biotech.
Biotech, where are you from?
Copenhagen, Denmark.
Okay, and beneficiary of the SM instrument or EIC?
Phase 1 and applying for the phase 2 now, yeah.
Congrats and good luck. And for the 2 other SMEs, present yourself briefly.
Yes, Celestia Group, 15 SMEs in different countries in Europe, but I'm located in Netherlands and we are subcon components.
Thank you.
Yeah, and I'm Michael. I'm also from Denmark, but from Jutland instead. We are servicing the industry by providing coatings for practically anything in the heavy industry in Europe. So focusing on making the world a better place, actually.
Thank you. Cool. So here, just to recall a few numbers, when we are talking about public procurement, it's almost actually 1.3 billions per year at European level that is used in public procurement. So it's a big trillions, not 1 billion, but 1.3 trillions euro that is used in public procurement in Europe. So it's a big budget. It represents almost 15% of the European GDP. So you can imagine how much does it represent. Also, when we talk about procurers, we estimate that we currently have 200,000 public procurers in Europe in any type, in any sectors, any type of them, central government, regions, cities, and all. And just to finish by saying that we know that in average, in the European member states, the winners of the public contract, normally it's something like 45% of them are SMEs. 45% of them are SMEs. And last number, 5% of the public procurement in Europe are cross-border procurement. It means that a procurer is buying a solution coming from another country. So these are also part of the challenges we are facing today. But I will quickly pass the micro now to Céline. You will present yourself and try to tell us a little bit what you have to tell us on the topic.
Yeah, thank you for the opportunity of sharing our experience today. So at Neuracare, we manufacture a medical device for orthopedic surgery. So here, that's kind of small product. We use it to repair the bones. That's the aim of our product, our technology. It's based on innovative biomaterial, which is called bioactive glass. And the aim here is to be fully absorbable and slowly repair fully your bone. So after a few months, the product is gone and the bone of the patient is fully repaired. In terms of, I have 2 examples in terms of procurement. The first one would be with private procurement in France. So we sell directly to private and public hospitals. And the process to go through the procurement in France is that first you need to convince the surgeons that they need to use your product because it's better, you have additional benefits. So that's the first step. It takes already a few months to convince the surgeons because it's a long-term product and they need to check over a few months it's working. So once you have convinced the surgeons, then they go to the buyer of the hospital and for registering the product. We had issues. It took us a very long time to register in this private group of clinics, a huge group of clinics in France, because they registered us as a Z company, meaning the lowest quality company, because they didn't know us. We were SME with small revenue, not known on the market. It was the first time we were selling to them, so they registered us as a Z company. And then none of the pharmacists would buy the product because we were not qualified enough. So it took us quite a long time, and in fact, in the end, we managed to get through it because we partnered with another French company who is supplying and manufacturing complementary products. They are manufacturing rods and screws for the spine. And they were already well known by these clinics. So we partnered and we went together to see the procurers. We were not competing, we were additional products together. And because we were going with them, the procurer accepted our file, and then we went to the next level. And all the clinics in France could buy our products. But this took an additional, I would say, an additional 1 year. So you can imagine for a small company who has already invested a lot in development, in registration, in authorization, an additional 1 year is a really long, long time. But this ended well, so that's good. The other example is not so good. It's an experience we had in Germany. To register the products there, you need to go through our range of products. They go through some coding. They call it OPS codes. So we first managed to find those codes, but then in the end, the hospitals were asking us to give them some proof, some evidence that other hospitals in Germany were using this code and actually got reimbursed. But we couldn't do this step because we don't have people in Germany, a task force could address each hospital in Germany. We do not have enough manpower there. So at the moment, we are stuck in Germany because we don't have enough resources to go meet hospitals and ask them one by one to do some testing and then start the process. So that's another example of the difficult situation. And for a small company as us, investing in Germany for some salespeople, that's not the possibility right now.
Thank you, Céline. Thank you. What I want also to stress before giving the floor to Timo is two things. Actually, we need to interact with the collective goal of we need to find solutions, ideas of any type of actions that we, the European Commission, but more precisely the EIC, European Innovation Council, the accelerator part of it, could do to support this matching. So I will invite the speakers, but also you in the room, using these post-its to write any type of ideas. Don't think about budget, just think about what could be done. No limits, no legal issues. What we could do as the EIC to stimulate, actually, to help Céline to get to the German market. What we could do towards the procurer or towards Céline, towards the SMEs and all the others. And just to recall, I didn't present myself actually, so but I wanted to do it just for people online. I'm Bertrand, working for the EIC though, particularly in this procurement of innovation aspect. And if you use my name and Twitter, you online, we can tweet together and you could ask questions to the panelists if you need. So use Twitter, Bertrand Vert, and ask your question, please do so. Same thing, if online you have any ideas, please suggest them. Pass the floor to Timo. Timo as a procurer.
Yeah. Check.
Yeah.
Okay, now it's on. So, I'm Timo Alalääkkölä. I come from northern Finland, Oulu, and from Oulu University Hospital. I work there as a manager of testing and innovation, and I'm heading the Oulu Health Labs, which is a testing, innovation, development environment for companies and for healthcare professionals. This time I will present our experiences of a couple of innovation procurement cases, which I've been leading in the past. I will go through the success factors, some pitfalls to avoid, and maybe present also some expectations for the future. Those cases that we have done in Oulu, or participating from Oulu, first one is the pre-commercial procurement case. It was called Thalia, where we developed a telemedicine system for intensive care units. And the idea was to create a cockpit view of the intensive care unit patients to get the overall view of the unit and even remote units around the university hospital. I also see familiar faces from Thalia project here happy to see you after many years. Yeah. And then the other case is in-demand co-creation project. This co-creation is something new that we have done. It starts from needs collection from the public organization. In this case, it's from healthcare. And then when we have find out those needs inside the public organization, we publish those to SMEs as a call for solutions.
Microphone. Here we go. Please, Timo.
Okay, I'm back. Yeah, so we publish our challenges as a call for solutions for SMEs. And when we get the solution proposals from them, and the big thing here is that the solutions are like formed based on the SME's technical competence. We are not pre-specing how we would like this challenge to be solved, but we actually get, based on their innovative capabilities, those solution proposals. And when the solution proposals are selected, we start co-creating together with the company and healthcare professionals. This co-creation phase can last up from 4 months to 1 year. And during that time, there are several meetings between the company and our professionals to finalize the solution. And it's been really, really good model of working. If we go in the success cases, so in both of these, Thalia and in-demand, the need is described by the healthcare organization, by public organization, but not really exactly specified. So there is always room for these innovative companies to address their capabilities and propose solutions. This is important because we, as a public procurer, cannot always know that what is the best in the market, what's available and what's the latest big thing. And actually we have even received proposals from the companies outside healthcare because the challenges are not always directly healthcare related, but that can be solved also by other technical competencies. And the real value of innovation comes when those solutions are applied into real operations. So in the co-creation, we can really, when we are developing solutions to real challenges and co-creating those, when the solutions are ready, we can instantly take them into use. And this is really important, and that is where the value of innovation happens. And thirdly, these co-creation meetings are important for companies because they continuously receive the feedback from us that what is needed and can adjust their development resources accordingly. Couple of pitfalls. One big thing in the innovative procurement is the lack of adoption.
Sorry, the lack of?
Adoption. It's a lack, when we develop something, but we don't actually get it into real use. Mm-hmm. And that frustrates companies, but it also frustrates our healthcare professionals. They can participate for development for several years, and in the end, the result is not taken into use. And that is also causing lots of challenges for the innovation activities of the organization, because we start losing the best talents to participate because they don't get the results in the real life. Yeah. What about the expectations for the future? I would say that we really would need to speed up the flow of innovation to the market. Like in Oulu, we are investing 1.6 billion euros for the Oulu University renewal and renovation. It's called OUS 2030 Future Hospital Program, and we are aiming to be smartest hospital in the world. And we are welcoming ideas that are radically different in that perspective, and would be happy to work with SMEs to create novel solutions for the future hospital. And we also would need from European Commission to support and enable execution of these innovation demand-driven models to make these things happen. And it's been game changer for Oulu University Hospital to be part of this co-creation project and to be able to work with these great SMEs throughout Europe. Yeah, I really believe in co-creation, and that's from three perspectives. Because when we collect the real needs from healthcare organizations and we share those with SMEs, so we can, the companies can adjust their research resources better, and then we can get great products that fit to the need, and that's all for the good of the patients.
Thank you. Thanks a lot, Timo, for this testimony. Tony, the floor is yours. So tell us a little bit more.
Okay, my name is Tony Verin. I work for an SME based in Murcia in Spain. And I'm going to start talking to you about two failures I started with when working with a health system. As an SME, we tried to invent new things, and we made the mistake of not including the demand in as part of the business. So I started developing some years ago two ideas. One was an idea about babies born with low weight. So those babies recover better at home than at the hospital. So we developed a mechanism with a mobile phone for the parents, taking the baby back home and communicating with the doctor at the hospital. So we went through 2 ethical meetings with the hospital, with the doctor, and we had a successful pilot with the parents. The parents were very happy to have this kind of solution because they were working at home, living at home with the baby. So it seems to be really nice, and it worked very well. And we also have the videos through the mobile phone. And babies born with low weight is 7% of the population of babies, so it's quite a big market. But at the end of the day, when we went to the hospital and we made an offer to deploy the solution, we faced 2 big problems. The first one is the IT guy doesn't want to integrate your solution into the IT system of the hospital. Mm-hmm. And the other one is money from the manager, no money. Even if it is cheap, but no money. And that was frustrating, as Timo was saying before. And I started to believe that no innovation was going to the health system because there are many ideas, but they don't go to the hospital because of those 2 big issues. And the other idea was about, now there are solutions on the market, when people have got a stroke or a car accident, they lose mobility in the hand. And so we developed a system where they've got a glove with sensors and a 3D monitor that can make this recovery test. Let's say procedures to try to recover the harmony and the use of the hand. So it was also very successful. We made a pilot with a doctor. It was with a big hospital in Spain. And at the end of the project, we went to see the manager. Okay, I'm going to buy it. No money. So it was also very frustrating. So when I got to know about this co-creation through this in-demand project, I was a bit reluctant at the beginning. I thought it's not going to work, but let's give it a chance because the needs come from the demand, from the doctors. Okay, so I gave it a try. We wrote a proposal. We were successful. We won the challenge on epilepsy, nothing to do with baby born with low weight, nothing to do with stroke and car accident. Is another study case, but because we are a technology provider, we can also provide solutions with epilepsy. And basically the challenge is how to communicate with your doctor when you have got epilepsy. There are big problems, at least in Spain. Epilepsy is 1% of the global population. In Spain, 44 million of people live in Spain, and 450,000 people have got epilepsy. So it's quite a huge problem. There are long queues to go to see your doctor. In our case, there are 2 doctors, there are 2 women, 2 neurologists, and they have got to take care of 2,050 people in Cartagena, in the south of Murcia. And there are also problems when, for example, somebody has got a crisis and is desesperated, he goes to the hospital and goes to the emergency, and there are also some queues at the emergency, and he talks to someone, but the someone is not the one who is specialist in epilepsy. So there is a lot of frustration from both patients and also from the doctors because they don't pay attention too much to their too many patients. Okay, so the solution was a mobile solution for the patient, so it can communicate together with a doctor. A doctor doesn't have the mobile phone because he cannot get personal data back home, so he's got a desktop. But together with this mobile phone, the patient is allowed to, let's say, comment, put his activity. The food is very important for this kind of people, what they eat, also when they eat also is very important for epilepsy. And when it comes to problems, then you can have a chat together with the doctor. And this is where the innovation is, because the knowledge of the doctor is going outside of its office. It's something very new. So it can communicate together with the patient with the doctor, so patients feel really comfortable, okay? And so the doctor also feels more comfortable because he can take care better of his patients, okay? So we want this nice challenge. We developed it, and it was a small budget at the end because we don't need a lot of money. It was 50K for the project. We got 30K grant, so we put 20 as from our pocket, but we got 30. It was 7 months, and we have been iterating a lot with the doctors in a very nice way with this co-creation schema, which works very well. And we were able at the end to deliver a pilot with 90 patients using the tool, and they are really fond of the tool. They don't want to get rid of it. It's part of their life because they can communicate together with their doctor. Okay, so my three main ideas, I would say, is okay. First, recommend the Commission to deploy more this kind of mechanism of co-creation, where the demand really drives the technology, or technology helps the demand. So more. Even if it is more difficult to manage because it's small pieces of money, but maybe more management, but it gives more chances to SMEs really to bring their technology into the hospital. Mm-hmm. So I went through the hospital because now the problem of the manager, the problem of the IT manager, and the problem of the manager of the hospital has gone because now I'm inside the hospital, okay? So replicate this kind of mechanism, co-creation. I think it's going to be very successful in the future. Then second, would be, okay, I'm inside, but it's not enough because I'm inside one hospital. Now, how can I scale up to other hospitals? Because other hospitals also have got their own way of working, even with epilepsy. So we've got to break the barrier of, I've got my tool, but okay, the other doctor works in a different way. He's going to adopt my tool, okay? So I'm inside, but not in one hospital. How to scale up in other hospitals in the region and also in the country, and then at European level. So there should be maybe some money here to help SMEs to replicate their solution outside this first step has gone. And the third recommendation I would give is to train the end procurer, the end users. In our case, it worked very well, but because we use agile methodology, so we use this kind of lean management with minimum viable product. Maybe you have heard of this. Every 15 days, we meet up with the end user. We validate the requirement, we show the design, we show the development, and so on. And so it ensures that at the end, the product responds correctly to what the end user is willing to have, okay? But we were lucky because we had two young girls, two young women, really happy to work together with us. So I would say that this kind of agile methodology maybe should be part of all this co-creation since the very beginning. So this is the way you are going to work, the supplier and also the care, so that the result at the end is the one that is expected. Okay.
Great, thank you, Tony. Actually, I've got already some people reacting online, asking questions about co-creation and these kind of labs. It seems that you're developing. But Roge, please, floor is yours. Immediate reaction on what you heard.
I'm Jorge Gonzalez. I'm the manager of TPOMED. We are a business association that promotes digital health across Europe. And basically, what we see here and what we have been hearing is nothing new. It's the typical way to do things is the technology push. We are mainly talking about health in this case, and it's like, okay, I have an idea. I try to, Tony have been saying that, you have been more successful, Celine, than in the first two cases. But the typical approach to procurers is that I have the idea, I develop by myself, I develop by my own, and then I try to sell it. Okay, and then what we see in a lot of different companies is that a lot of companies are developing solutions for problems that nobody have. They go and say, but I don't need this. Why have you spent your time, your money, your illusion in developing this when this is not needed? And then at the same time, when you talk with the healthcare organizations, they have problems, but because they are very much into the system, they are not well known by the people that they can solve it. So that's why we have tried, there are different schemes, we are trying to say, hey, can we do better? Can we set up a new models where the problem is first identified by the customer, and then because we communicate that problem to the people that they can solve it, they co-create together, so they come together to a solution that it will have more chances to be adopted, which is another thing that has been mentioned by Timo and by Tony. Okay, so this is the overall idea, and that's what I think is the core of what we are talking about. Can we do better? Can we be more efficient? Not only for an individual company that is solving having an idea, trying to solve a problem, but also we have seen that a lot in European projects, that you have a consortium also with potential technology developers. They do something, they develop technology, it works, the project is a success, but then no first customer. And you know what? If you are an SME, if you don't have a first customer, you will never have a second one. If you have tested a technology with someone, and that person, that organization doesn't buy your technology, it's very hard to convince a third organization to procure for your technology, okay? Because probably you are not telling me everything that I need to know about this, so why did you buy? So it is very important that we do pilots, because pilots are important, we are in innovation. If we know that works, it's not innovation, you just buy from the market. But if you are doing co-creation for innovation, it's very important that if it is successful, then there is an adoption, okay? Now, what's the problem? So we want to connect the people with the problem with the people with the solution.
Procurers and SMEs.
Procurers and SMEs in our case. Where do I see what is the most difficult part, or where do you guys think is the most difficult part to convince? The SMEs or the procurers?
Any ideas, reactions?
Any ideas? Don't be shy.
Experiences eventually? Yes, please do. Our Danish colleague.
So for us, it's the procurers. They are the most difficult to convince.
Right.
But also they are the easiest to change to another, supplier for whatever they want to buy.
Experience behind that?
Yeah.
Please.
Okay, so we provide coding for the industry. The technology comes from milling and drilling tools, and exceptionally in that market, if someone can offer something cheaper, it doesn't matter if it's better or worse, it's only the price. And it's practically the same in the whole industry. So you can be as good as you want, but if someone has something cheaper, it doesn't matter. And they don't care if their business will actually be better. That's my experience with procurers.
Right. Okay. So going beyond that, thank you very much for the point. So remember, if you're in a mature kind of market, then price is something to take, especially with public procurement, because that's the problem. Because when you do public procurement, it's not free. It has rules. When you talk with private, if you're a private company, you can do basically whatever you want to do if you want to acquire goods or services. But if you are public, you have to convey to a number of rules. And at the end, probably the most important indicator is price. And probably if you want to be the smartest hospital in the future, if you only take price as the criteria for selecting the technology or incorporating the services, you will not do it. That doesn't look very smart. So the key thing is how can we convince procurers to bet on innovation? That there is more hunger for innovation, that they are willing to embrace small and medium enterprises, even startups with, at the beginning, no credibility, to give them a try because what they offer is really promising. In our case, what we think is that it goes beyond one single project, is how you change the culture of the public body towards innovation. And for that, if you stimulate the entrepreneurs within the the public body, the people that they want to change things. So believe it or not, even if there are civil servants, there are people that they want to improve their work, and we know a lot of them. But right now, they don't have channels to go to their management and say, hey, I've seen this problem. I don't know how to solve it, but I really want to participate on it. And even they spend the time, their free time, they do it after work because they are passionate about helping, in our case, patients. The thing is that usually there are no kind of corporate channels in public bodies to funnel all this willingness to help. So in this project that has been mentioned before in demand, we have set up this kind of channel with entrepreneurs, people with ideas, with challenges, propose challenges to the management, and then this challenge is connected with a small and medium enterprise, with an SME, and they co-create together. Now, how can we systematize that? Maybe something that is a good question for the audience. If you guys have any kind of ideas or solutions or bottlenecks, then say, okay, so what you know about the public body, how will you change the culture? What will you change within the public body so they are more open to collaborate with the small and medium enterprises? You guys have any idea, any proposal?
Any immediate reactions? Meanwhile, I can say, Anna, we'll pass the microphone. Just to say that, our equation here is that we are the EIC, European Innovation Council. We have already these 6,000 very innovative SMEs, plus researchers, plus investors and large groups around us, our ecosystem. The equation is, exactly what in the coming years we could imagine, apart from PPI and PCP, pre-commercial procurement, public procurement of innovation, that our colleagues in the Commission are doing very well already, what we could add to this. Certainly, perhaps some more agile, smallest actions, precisely, perhaps not targeting that much the procurers themselves, PPI and PCP are doing it, but perhaps targeting or helping the SMEs. Co-creation, Timo, how we could come, EIC, Oulu Hospital, we have our 6,000 SMEs and much more to come, what we could do to support you in your nice project of refurbishment, of development of the Oulu Hospital. I mean, that's an open question. Anna, present yourself.
Hello,
please.
yes, I'm Anne Müngersdorf and I'm working at the Innovation Agency in the region of North Rhine-Westphalia in Germany. And I'm very familiar with innovative procurement. I have been 2 years at OECD and working on public procurement for innovation. And I work together with leading practitioners in public procurement. And sometimes I got the contact to the SMEs as well. So I learned from both sides, and the RTOs as well, the big research organizations. And one advice might be for the SMEs and for the procurer as well, get into contact with the Enterprise Europe Network. They have a thematic group, it's called Procurement, and innovation procurement is as well mentioned. So here you get all the innovative calls on procurement where you might, as SME, participate in. And there are sector groups in which you can as well participate and go to the Enterprise Europe Network, get aware, and there in the member states there are, in the meantime, competence centers for innovation procurement.
In Germany particularly?
Not only in Germany, no. Mm-hmm. In Portugal, in Ireland, in Europe. Mm-hmm. Not everywhere, but a lot of in Europe. But nevertheless, you get into contact, there is a network, and you get informed. And especially for, now I must check the name, Celine?
Celine, yeah.
Yes, Celine, when you go to the regions in North Rhine-Westphalia, because Germany is a big country and has 16 regions, then it might be easier for you. You can get into contact with me in the region of North Rhine-Westphalia. There is UNICO. There are 6 university hospitals working together in collaboration. And perhaps it's a chance for you to get into contact with them.
Thank you. Thank you for the introduction. I just have one comment, maybe, because we talk a lot about co-development, but as experiencing the public and private procurement, one very strong thing is the trust. We don't have the trust of public and private procurers. And I strongly believe that the EIC would be a huge help gathering SMEs, for example, in the healthcare, gathering SMEs in the same area, not competing, because I mean, it's a huge, several medical device. For example, an orthopedic surgeon in its medical equipment, implants, imaging systems, fluids. So we go all together to public or private procurement and then provide them like it's a one-stop shop, and we are endorsed by the EIC community. So that would make, I think, a huge change.
Could you develop on that a little bit? How you would see it very concretely? You mean that we will come to you, actually? I mean, our beneficiaries, the SMEs, We'll go to hospitals, to procurers. 1 day, 2 days. What do we do there?
Maybe we could do the other way around, like meeting procurers, analyzing what their needs are, getting a list, and then proposing to the network of SMEs the needs of those procurers, and then filling the list and the needs and coming together and meet like 1-to-1 or 10-to-1 meetings and make sure they buy all of the equipment from those EIC SMEs.
The good news is that, yes, I've got some colleagues who will mention his name, is Manuel Mendigutia. Manuel is doing kind of similar things with what that we call the corporate days, actually, within the EIC accelerator. So basically, we're in contact with large European corporates, and L'Oreal or Enel or whomever you can imagine, Nokia, and we tell them, okay, guys, listen, please go around your departments, try to find some challenges in different departments. Together, we go through our 6,000 SMEs, and you select the SMEs department per department that you would like to see pitching or meeting you, actually, to try to solve or to help in solving your challenge. Would it be a bit the same concept with the procurers?
Yes, that was kind of the idea.
Roger.
The problem with this approach is that maybe the procurers think that you are just another commercial agent from the companies. Another alternative approach could be that you get the trust of the procurers and you become like the hub, saying, guys, I can help you to get you in contact with the right solvers for your challenge. And you get the challenges, you prioritize the challenges according to your criteria, and then if there is some kind of incentives for the joint co-creation of the solution, because maybe the challenge that the organization has is not exactly the solution that the SME has. So there has to be a delta in order to do that.
So what is the delta? Sorry, money?
No, the delta is that maybe it's functionality, or it needs to be adapted. So maybe what it has happened, for example, in the case of Tony, is that they have the core technology, but needed to be adapted to the particular problem. And the good thing about that is that if you somehow manage to get a co-creation space within them, there are two things that happen. First, there is trust, because they get to know each other in a system. And second, because if they are together in a program with a deadline, and if there is some money involved, then especially the SME is going to go behind the procurator to say, come on, we need to fix this deadline, because otherwise we are not finishing the project. Because what we have seen also is that in some healthcare organizations, they also do innovation, but because rely on the goodwill of the healthcare professionals, it takes forever. Because, whatever happens, family, work issues, whatever, it's always delays because there are no deadlines. So if you can combine, okay, EASME is going to be a hub for challenges. And once we have a good challenge, we somehow are going to support it, to do a connection with a company, and then a co-creation scheme. And then, and that's the last bit, you make sure that the challenge that is proposed to you, it has a commitment. Because otherwise it will be yet another research project that is not adopted. So by aligning the ecosystem, the whole ecosystem, towards the the powerful challenges that you guys, you will get like a virtuous circle where everybody wins. An idea.
Thank you. Timo, you're eager to react. Does it sound like interesting for you?
Yeah, that sounds quite okay. We have done this collaboration together with, we have 5 university hospitals in Finland, and we are collaborating quite actively together. And one thing that we are really interested is this collaboration with the companies. And how? So we have started to create a model where we could collect the challenges out of these university hospitals and then recognize the ones that are common for all of the university hospitals. So those would be applied throughout the Finland. And then those could be these kind of seeds and challenges for companies that could attract even companies around the Europe. And then we could co-create the solution for that. And why not to do this with like a pre-commercial procurement? That's the timeline. Timeline of the PCP is quite long, and it's challenging to spend 3 years of development and still not having this solution in use. So that's where the strength of the co-creation comes. It's quicker way of getting this co-created solution in the use.
Any immediate reactions in the public? Yes, please, present yourself and go ahead.
Hello, my name is Kyriazi. I'm a consultant. I worked for the Commission for many years as an evaluator, and I have done statistics also for the European Commission in Luxembourg, for Eurostat in high tech, and for many years ago. And what I see very important in your products is to have also be granted as European patents. I don't know, did your products pass from the European Patent Office, for example? Because there are people working, I don't know how much time they take. 1 year for medical uses. I think they need more time in order to be tested on humans and see the real results on them. The other thing is that there is a trade war between China and the US, and also Europe is in the game. And you know, I mean, we know all that there's so much in international level.
Okay.
And as it happened also for me to do the database of products coming from China, like as you mentioned, China, and there are also defaults.
Okay, so
in them.
Supply chain
How could
management.
the European products could be more competitive as a quality and as value of money in order to compete those markets?
Quality and price and the supply management, IPR issues. Do we want to go into these debates?
IP.
Please, Tony, a few
Yes,
words.
in terms of patent, because our tool is software, so it's not possible to patent because it can be copied. So it's no reason to patent it. And then about the CE mark, because maybe it's related to have the CE mark. We don't have to do it in our case because it's just an information channel. We don't capture data. So we check it out together with the doctors, and we don't have to have the CE mark. So for the patent and the CE mark, in our case, it doesn't apply. In case there are some databases about competitors, then we're happy to know about that. But in our case, we made a study. I mean, the doctors made a study in Spain at least, and there is no such tool like the one we have developed to be able to have a chat together with the doctor for epilepsy. So there are web pages where you can get information, but no communication, direct communication between the patient and with epilepsy and the doctor. So in our case, I think there's there might be competition, but I don't know where.
Thank you, Tony. Just, I would like to get a little bit back on what we discussed with Jorge and Timo. And you were mentioning, Timo, that you surprisingly have common challenges in several hospitals in Finland and elsewhere in Europe. Surprisingly, was ironic indeed. So it means that you've got a potential big market on new challenges that you are facing. Could you develop a little bit, imagining? Let's imagine it a few seconds. How the EIC, how with the €1 billion we have behind us, and all these very innovative SMEs, researchers, and all, how we could help you in these challenges? How we could come to you? How we could work together? What we could put money on the table to stimulate the SMEs before you launch your calls? These kind of things. Does it speak to you this in the co-creation process?
Yeah, I would say that this kind of support to enable these co-creation, co-launches, and then especially working together with the companies, maybe to support this development phase, those are really essential. And we have had some debates that how this kind of co-creation should be facilitated inside the organizations. So in Oulu case, since we have the Oulu Health Labs, which is an innovation unit inside hospital, so we already have the innovation personnel there. But then in all the healthcare organizations, the situation is not the same. So they maybe do not have the innovation resources. So I don't know if that could be supported somehow to enable this kind of activity in the public healthcare.
And do you think you could align this challenge with other hospitals, meaning working with other procurers around you and...
That would be a development topic too. We have done this initial collaboration between 5 university hospitals in Finland, and we have an initial model already available that how we could collect these challenges and how we could maybe shape them as common challenges throughout the Finland. But that has not been executed. It's like an early draft at the moment, and that could be potential area of development. Really good.
Thank you, Timo. Before you, Jorge, I give the floor to Ivo colleague from DigiGrow.
First, I would like to thank Bertrand for organizing this session, which is really very interesting also in terms of panel.
And François Brizard. I use this opportunity to thank François, a colleague.
And of course, you are doing a great job as moderator, so I think we will use it in the future for other events. Now, I have a question. I come from the public procurement world. I'm not a lawyer myself, but based on our experience and based on the directives that we used to manage, I have a difficulty. So I do a little bit the devil's lawyer job, unfortunately. I see that there is a kind of friction between co-creation, and the difficulty is really reconciling this moment of common development between the buyers and the suppliers, and the need to have certain guarantees for competition, non-discrimination, which are set out by procurement legislation. I see there that there is a challenge, and how to reconcile it is really difficult. I also want to stress that this legal principle can be maybe boring, but they are extremely important, because it's extremely important also for the buyer to have a competitive market. And secondly, which is also important for innovation, and second point, that we are talking about public money. And given as we are talking about public money, it's extremely important this is managed in an efficient manner. The very last point I want to say is that yesterday I assisted to another interesting session here, and we were talking. The objective of the session was corporate procurement, and
private procurement. Go ahead.
By large companies,
yep.
And I have to say that I have the feeling that in the end, for very large corporations, is not that different from public procurement. Of course, there is not maybe an obligation to publish, the rules are not the same, but, for example, there were SMEs complaining about corporate social responsibility criteria being imposed for them, which were burdensome for them.
Co-creation,
yes.
Talking about supply management,
exactly.
Quality of the product, and thanks for the testimony, Timo. Just to say on what you recall as the legal boundaries, we just said at the beginning that let's forget about money, let's forget about regulation or for 5 minutes, or laws or directives. Let's try to be imaginative. So it's another call for you to write on these small post-its any ideas you have, that what the EIC Accelerator and the EIC family could do to support this innovation procurement and SMEs. Jorge.
I have a mic.
Yeah, sorry.
So I have an answer for you, if I may, just to make clear that it's feasible. So the beginning is that you have a challenge that there is no solution in the market for. So we are talking about innovation. We are not talking about something that is already in the market. So what you do in the first phase is that you co-create a solution just to deload the risk, just to make sure that there is a solution that is feasible. And doing that, you do a selection of partners, and you pick one just to do this experimentation to see that is feasible. Okay, or you can do like in PCP, you can have several in parallel. Then you evaluate, and after evaluation, you do the procurement. And then the procurement follows all the procurement rules, open, transparent, blah, 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 blah. So you can reconcile both things. You can reconcile co-creation with one or several solvers together with procurement, because you do it in different steps. Okay? Some of the procurers don't like that. They will say, I will just wish I could just follow up with the co-creation. But because there are these rules, you can split the process and do the procurement. Now, what is the problem that we usually see? The problem that we see is that we do too many pilots. Most of them are successful. But even if they are successful, there is a value of death afterwards, and they don't get adopted. So that's why it's very important that if you deal with procurers that they give you challenges, that there is a kind of commitment and a trustable commitment, so that if the Commission is going to invest money in your challenge, you commit to adopt it at the end of the day if it is successful. Because otherwise it will be yet another pilot that goes nowhere. And this is not neutral. It frustrates everybody, like Timo was saying. So commitment to adopt the solution in the first place is critical in order to have this first customer, blah, 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 blah.
We still have, thank you, Jorge. Still have 3 minutes. We can take 2 questions. Anna, you're the first and the second one.
It's more an,
comment?
I would say, comment or a recommendation, because today and yesterday, or the whole 3 days, we spoke about synergies. And I think the co-creation is nothing else than building synergies. And perhaps it is an idea, just it came into my mind because I'm following the procurer perspective and the SME perspective, that apart from Horizon Europe and the European Innovation Council, because money is limited, the European Structural Fund should be easily now be linked to this development to the European Innovation Council, so that easily money can be transferred, and that there are interlinks for legal aspects, for these legal burdens, and as well for the financial later management.
Indeed, the very good news is that several of our panelists are working with ERDF funds, I believe, if I'm not wrong, particularly in Spain, where they're using ERDF to support procurers to link with SMEs. We could say a word before we close, perhaps. Any other reactions in the room? If no, I would invite, first I would make a deal with testimonies in the room with Timo, our dear procurer, that, I mean, you can invite us, I mean us, the EIC, all our companies. You can pick in our 5,000 companies, choose, select the one you want to see coming to Oulu with great pleasure. And we do there 1-2 days of co-creation, innovation, stimulation, answering your challenge, and all the hospitals you mentioned working with you. I mean, we're ready to do so. Give us a date, we'll be there. And
Yeah,
you have the
sounds
floor,
great.
each of us. Each of you, please say a few words before we close the session. Ladies first? Céline, if you want to say a few words, closing the session, what you grab, and perhaps one extra idea that you would have, how we could, us, the EIC Accelerator, work for you, the innovative SMEs, to get public clients and private.
Co-creation, of course, is very interesting, but for many SMEs, the product is already on the market and it's responding to a need. It's just that it does not address and go to the end user massively. So the idea of what Manuel is doing on the SMEs meeting together with corporates, I mean, I've done that several times, and it's working. It's amazing. You meet the deciders, the people who decide in those big corporates, and you go and you go fast, much faster than meeting them in Congress or this kind of event. So doing that with procurers, definitely, I see that as a huge potential, as being really in the market and in those areas really deeply involved. So that's for me the biggest idea, the one who really would go very fast for us.
Merci, Céline. Timo, you got the micro?
Yeah. Okay. Check. Yeah. So I think this topic of culture change, that is happening. We have noticed that when we take these healthcare professionals to participate, when we collect the ideas, development suggestions, challenges from them, and then we get those real solutions to these challenges. So it really also empowers our healthcare professionals. They have been really happy and eager to participate into this innovation action and into solution co-creation. And I am extremely happy about that. The culture change is happening slowly but surely.
Thank you. Thanks a lot, Timo. Tony,
Yes.
last words?
From my side, or from the SME side, again, I agree with Céline. We have to go massively to get to the end user massively. So I'm really keen to get to these corporate days and also to this kind of grant I've heard this morning with the EIT e-health and this kind of mechanisms that help us to grow, because this is what we need. I'm not going to hire a big bunch of sales and commercial people to sell my solution because I don't have the resources, but I've got to find some ways to really try to deploy my solution worldwide. I mean, at least to Spain and then Europe, and then we will see. So I'm happy to see that there are some means provided by European Commission to help me in that endeavor. So I appreciate that. Thank you.
Jorge, por favor.
So there are two things. One is what you are already doing for supporting solutions that are already in the market and getting them to commercialize faster, which is already done. What we have been talking about about co-creation is perhaps more to help to identify new opportunities to other companies. And for that, I understand that the ASME and the Commission is very interested in supporting SMEs, but SMEs are ready to play the game. What I'm saying and what I'm insisting is that the difficulty is usually more in the procurer side. So by helping the procurers to be in the game, you will help SMEs to connect with them, and at the end it will be a win-win for everybody. Procurers, they need support perhaps in getting to know, understanding, getting capacitation, getting also how to develop challenges that are relevant to SMEs. They need that kind of support, putting together programs where they can co-create together. That will really help, because again, it's not so much for the money, it's also for the deadlines. And then helping to change the whole culture of public organization or even private organizations towards innovation. That's the final goal, because if you change the culture, then people will be asking for it. You will not need to convince them. You will need to stop them. And that's what we want, to stop them. Right now, they need to be convinced.
Thanks a lot. Thanks to all of us participating in the workshop. And actually, it's just the beginning. It's just the end of the way forward in innovation procurement and the EIC. Together with my colleague François Brizard, very welcome to talk to you bilateral and to grab your ideas and to work together in the future. Don't forget your post-it. Please give it back to us with your brilliant ideas and keep in touch. Thanks a lot.